My dog.
Right? 1 to 4. Right. So life history of keratinocyte, right? We kind of mentioned all the different, just when we talk about a keratinocyte, number one, understand what we're talking about. That's the name of each of the individual cells, right? So each of the individual cells that make up the epidermis, well, those billions and billions of cells, each one is called a keratinocyte. And they're produced deep by stem cells found in the stratum basale, right? That's the layer, that's the deepest, most layer of the epidermis. That's the layer that's anchored in place, right, to the basement membrane. So this is the layer that is going to have the most, right, majority, like 99% of the mitotic, right, regeneration here. By the way, when you get a cut, right, why do we do stitches when we get a cut? Well, we do stitches, number one, so then you have faster healing. But when the cut is so deep or so big, right, what happens is if you don't do stitches, right, that layer that is cut in between will no longer have stem cells, no longer have stratum basale cells, right? And now because you have so much room in between the edges of your cut, when you do heal, all the stuff from underneath, all that collagen from the dermis, right? All of that overgrows your epidermis, right? And what happens when you have a lot of that collagen from the dermis overgrowing your epidermis? You're going to have a scar, right? You're going to have a keloid in certain people, right? So what do we do when it's a big cut? Well, what we do is we take one edge of the cut, take the other edge of the cut, stitch it together. As we stitch it together, we seal that membrane. So then there's no room for the epidermis, for no room for that collagen to grow into the epidermis, right? That way you don't get a scar or a keloid that forms, right? And it makes it easier for us to heal from that cut, right? So just keep that in mind that there are really important reasons why we do have stitches. Nowadays, we're a little bit more hesitant to do stitching if it's not like something that can produce scarring, right? In the life history, it takes about 30 to 40 days for a keratinocyte to make its way to the skin surface and flake off, right? Just like everything else, everything slows down with old age, right? It's faster in skin that's injured or stressed, right? Calluses or corns, thick accumulation of dead keratinocytes found on the hands and the feet. Calluses, there's a reason why we have calluses when we start working out. So when you start working out, your hands gets full of callus, right? Especially on where your first knuckle starts, right? The reason is as you're grabbing those things, right, and pulling and putting pressure onto the skin in those areas, you have premature death of the very superficial layer called the stratum corneum, right? So now that layer thickens a lot, right? In the way of just hopefully protecting you from more damage. Now, what happens when you stop working out? When you stop working out, you no longer have that insult of grabbing things with weight and pulling, right? So as you stop working out, you start to regenerate the normal skin. You don't have that thickened stratum corneum anymore because you don't need it, because you're no longer grabbing something, gripping it real tight, forcing it down with weight, right? And it causing increased stress on that region of your skin anymore. The best example of this is my dad. I'm like, what do you mean, my dad? All right, I'm your typical Indonesian Asian that when the parents moved to America, all right, what do? They owned a Chinese restaurant. Classic, right? So my dad and mom, I have never, right, seen them ever hold hands, right? Never, right? It's already bad because classic Asians, they don't show love anyways, right? So, I've never seen them hold hands, barely seen them hug, right? So I definitely didn't see them hold hands. So why am I mentioning it? Well, I noticed when my dad, he was the cook, right, in the restaurant for years, and my his hands were just always cut up and callous. It was kind of like even had a weird color to it. It's kind of disgusting, right? I wouldn't hold his hands either, right? So, all right. And then one day after he retires, like a year after they retired, I saw my mom and they were holding hands. I'm like, huh, what the hell are they holding hands, right? They never hold hands, right? And my mom goes, hold your dad's hand. Of course, I'm like, why do I need to hold my dad's hands, right? I'm like 35 already, right? I don't need to hold my dad's hand, right? Just hold the hand ready, right? So I held his hand, and because he was no longer cooking and getting all that, right, kind of insult, right, from the cuts and the burns, right, it was smoother than mine. I was like, oh my God, it was like a baby's hand, right? I'm like just grabbing, I couldn't stop grabbing my dad's hand after that, right? It was so soft, right? It was and it was like only 6 months after he retired that he was able to kind of regenerate this normal skin that most of us have, right? And that was it. He never cooked a day after that, right? So when we looked at, it's just kind of cool just how fast that our skin can regenerate. Think about how, especially in babies, right? How fast their skin regenerates kind of is crazy, right? Have you ever seen like a baby with a little scar or a little cut, right? They can like go to sleep with a cut and the next morning it's gone. It's like completely gone, right? I remember one time my daughter got a little cut from her scraping herself with her own nail. And we're like, oh my God, don't tell grandma, right? Like, do not show grandma. She can't come over today, right? So we're all scared because I know we can get yelled at. So we kind of, push grandma aside for that day. I'm like, all right, my mom was like, all right, something's wrong. So I'll come over now, right? And they're trying to stop her from going into the room the next morning. And she comes in and she just looks, oh, she looks so good, right? She had healed overnight. Right? That was that fast. And it was like something that was a big, long scrape on her face. I'm like, oh, that's great, right? And it's just amazing how fast babies heal because how fast regeneration happens in babies. Now, the stratum granulosum, three important developments occur here. I do want you to know the stratas, right? So memorize the stratas because it's kind of easy, right? Basale, spinosum, granulosum, lucidum, corneum, right? When we have callousing, it's increased density in the stratum corneum, right? When we look at like something like thick skin and thin skin, right? We're going to talk about in a second with thick skin and thin skin, right? Thick skin has all five layers, right? And we're going to see that the stratum lucidum layer is found in the thick skin. Thin skin, we don't see it, right? The weird thing is, again, you would expect because it's thicker with more layers that you would see less sensitivity, right? In reality, thick skin actually is more sensitive, right? And thin skin, we can always tell as well that is a little bit less sensitive because every now and then you might look in the mirror and next thing you know, you have a couple scrapes on your chest or a bruise on your arm, right? And you don't even know how you got the bruise, right? Why? It's because you don't even notice it because it's so much less sensitive versus when you get a paper cut on your finger. You guys ever gotten a paper cut during a paper cut, right? You're like getting the paper cut and you're like, oh my God, it's gonna go deep, right? And at the end, it's just a little paper cut, even though it feels like it really hurts a lot, right? Why? It's because it's so sensitive. It allows us to really localize where that pain is. Now, right. Yeah, like when they talk about filaggrin and keratohyalin granules, I'm not going to ask you to memorize that, right? What I will ask you guys to do is just kind of understand the process of just being moved upwards, right? The higher up, the more layers you're away from the stratum basale, the less nutrients you're receiving, the more likely those cells are going to die off. Perfect, right? Now, and memorize just the names of the actual layers, right? You have to be Sally, spinosum, granulosum, lucidum, corneum, right? Now, epidermal water barrier, right? There's a between the stratum granulosum and stratum spinosum, we have this water barrier. Consists of lipids secreted by keratinocytes and tight junctions between the keratinocytes. The lipids is a big one, right? We know fat and water don't mix, right? We know that, right? Now, what? Because fat and water don't mix, what is the natural way that then we can waterproof, right? We can waterproof things naturally by putting a layer of lipid or oil on it. So when you look at something like, I don't know, I'm going to use an example of animals, right? Ducks. Every now and then you see a duck and they're sitting, right? And they're floating and swimming on the pond. Why don't they sink? Number one. And how do they fly if they're just sitting? Won't their feathers get waterlogged? Right? And they get waterlogged, it gets too heavy and they can't fly. So how come they can still fly? Right? Even though they've been sitting in that pond swimming for hours. Simple, right? You will see with ducks that they will use their beak and they will kind of pull their beak, put their beak right underneath where their wings are. There's a little gland underneath their wing. That gland has an oil, right? That oil then they use their snout, right? And then their beak, right? They use that oil and they put it all over the feathers, right? Waterproofing their feathers. By waterproofing the feathers, then the water that they're in just kind of moves away out of them, right? It doesn't cause the feathers to be water, all right, kind of to be kind of water soaked, right? So then it doesn't get heavy. All right, so our body does the same thing. We have this lipid layer that actually protects against water loss, whether coming in or out, right? And is critical in preventing dehydration as well as water coming into the body, right? So this kind of lipids that we secrete and right tight junctions plays a big role in all this, right? Cells above the water barrier quickly die. Barrier cuts them off from nutrients below. Dead cells are exfoliated, turns into dander. Just sounds gross, right? And dandruff, clumps of dander stuck together by oil. That sounds even worse, right? So when we look at, and again, I always use the example of people with psoriasis. People with psoriasis, they have just a magnification of this kind of life history of a keratinocyte where things get pushed up really quickly and they shed those cells even more often than we do, right? And by the time they sleep and they get up, they'll have a layer of this dander that's actually surrounding them on the bed, right? So they have to, vacuum that up. I know, sounds gross, right? Because you can imagine most of us don't experience this unless we have a sunburn. Right? When we have a sunburn, then we can flake that skin off. It's kind of fun to do, right? Can you imagine that happens all the time though? And you have no control over it. That's what happens with, right, some kind of psoriasis. All right, the dermis, deep layer, connective tissue layer beneath the epidermis, right, can be pretty thin, right? Again, in the eyelids are the thinnest, to pretty large and pretty thick in the palms and the soles of our feet, composed mainly of collagen with some elastic fibers, some reticular fibers, and fibroblasts. All right, I only highlight the collagen and elastic fibers for a reason, right? Number one, that's the most important constant here, right? That you need to know that there's tons of collagen under the epidermis. That collagen is going to be incredibly important in that it allows us to have a lot of strength. So then when you move the skin, there's a lot of strength in a lot of different directions, right? So they can pick up the skin, right? And then once you let go, it goes back down. You can push it. And when you let go, it goes back, right? You don't rip the epidermis from the dermis. Now, if it's hard enough, you might, right? If you put enough stress, you can disrupt that junction between the dermis and epidermis. But usually it takes a lot of force, right? Unlike the epidermis that does not have any blood vessels and is avascular, the dermis has tons of blood vessels, right? The epidermis is just skin, right? It's just those keratinocytes, melanocytes, dendritic cells, right? Just cells, right? But in the dermis, we have lots of really important things besides cells, right? We have blood vessels, we have sweat glands, we have sebaceous glands and nerve endings here, right? We also have smooth muscle here, right? Here, these smooth muscles are called the erector pili, or piloerector muscles, and they allow the hairs on the arm, the hairs on the back of your neck to come up when you get scared, right? Anybody's ever had that when they're watching a movie or you're outside and it's really dark right? And you just have that kind of, like that spidey sense that comes off, right? Like something's coming at me, right? And your hair comes out, right? Now, you're probably wondering, why is that protective, right? Why do we have this kind of, right? I think the Hawaiians call it this chicken skin, right? Where you get kind of nervous and scared, and all of a sudden, all your hair comes up, right? There's a belief that even if you receive a stimuli just a few milliseconds before when you should, that is helpful. Meaning what? When somebody's about to grab you, right? If your hair is up, that that motion of that grab, right, is going to cause air molecules to move. And that could trigger those hairs already standing up. So then you're more able to react when you're getting, right, grabbed, when you're getting, pulled, right? Now, most of the time it doesn't happen that way, right? And nobody's grabbing you. So just keep that in mind, right? Right, we call it goosebumps as well. Again, the junction between right here is probably a better picture, right? That up and down junction between the dermis and the epidermis, right? Well, that junction between the epidermis and the dermis right here, right, moves up and down and becomes the framework of our fingerprints, right? We call it the dermal papilla, right? Upward finger-like extensions of the dermis. The reason why we have it, right, is because it increases our grip force, right? Now, it also allows us to have fingerprints. And fingerprints are going to be, right? You can have identical twins and they can have different fingerprints. So everybody's fingerprints should be unique to themselves. Now, you have heard of people that are really OCD, right? Everybody, like you guys, young generation likes to use that term a lot, right? Like, yeah, I'm OCD about this. No, I mean, you're not, right? I mean, real OCD is really bad, right? Those are people that wash their hands hundreds of times a day. And then once it gets bad, not only do they wash it hundreds of times a day, they'll wash it and scrub it, right? Hundreds of times a day. As they do that over and over again for many years, you can actually dull out that dermal papilla and they don't have fingerprints, right? Now, most of them are not going to be criminal masterminds, so that's a good news, right? Because, right, can you imagine a criminal mastermind that is OCD, right? They'll never leave the house before they wash their hand 300 times, right? Then the banks are closed. How are they going to hold them up, right? So yeah, it is kind of they can dull it out, right? So then you don't have fingerprints. We also have footprints. So if you ever seen, usually we don't worry about those, but with babies, infants, right, newborns, we show their little footprints. It's very cute, right? After that, we never look at the footprints ever again. Right? So the papillary layer, so in the dermis has two layers. The superficial layer is pretty small. We call it the papillary layer, right? Because of the papilla, right? Then that papillary layer makes up 15 to 20%, has a little layer of areolar tissue, right? So then the blood vessels can go through, right? It is rich in small blood vessels. The deeper layer, close to the hypodermis, is called the reticular layer, consists of a lot of dense, irregular connective tissue, right? Is deeper and much thicker than the papillary layer, right? This is where we start seeing stretch marks, right? In certain Nobody likes seeing stretch marks, right? But we all get them, right? Unfortunately. So when you get a stretch mark, there are reasons why we have stretch mark is that, right? Even though we should have irregular, right? Collagenous dense connective tissue here, we do have these in the skin, right? Some collagen that follows the outline of the muscles deep to it. Kind of makes sense, right? You want the skin to move with the muscles deep to it. So we have a little bit more collagen along that line of stress with the muscle as it contracts. What happens if the muscles get too big, too stretched out, right? Well, you can overwhelm that collagen. Remember, it's not super strong. And then you have stretch marks as you overstretch the skin as the muscles deep to it starts to grow, right? Or when you have a baby, right? That happens too. So here's the structure of the dermis. Would I ask you any of this on the test, lecture exam? No, right? Again, highlighted material, right? Hypodermis, and then we're almost done. The hypodermis right here, with the hypodermis, right, with the hypodermis, all right, it's also known as a subcutaneous tissue, right? It's got lots of adipose tissue, right? That's a big telling trait. It's got tons of adipose tissue. It pads the body, binds skin to the underlying tissue deep to it, right? Now, the thing about the hypodermis is that most of our medications, right, can be introduced into the hypodermis. Anybody gets frequent migraines, right? If you get frequent migraines, you might have had a shot of, right, sumatriptan, right? That kind of a shot where the needle is that small, right? Again, to me, any needle's pretty long, right? So even a small needle like that, insulin needles are pretty small as well, right? When we're introducing either insulin or Zomig or any sumatriptan into the bloodstream, the needle only has to go through your skin, right, and into the hypodermis right here. The blood vessels here are much larger, right? So then when we introduce that medication into the hypodermis, it gets easily introduced into your bloodstream, right? It's highly vascular. There's a lot of them, and the kind of space between each cell is going to be much bigger, allowing for increased absorption, right? Now, we can also see lots of subcutaneous fat, right? It forms an energy reservoir, allows us to have thermal regulation. And unfortunately, women have 8% thicker. I don't know why we get so specific too, right? 8% thicker in women, right? That's kind of general, right? So, unlike when we store glycogen in the liver and only in the skeletal muscles, we can store fat just about anywhere, right? It doesn't just have to be in the hypodermis, right? It can be inside your abdomen. It can be on your actual heart, even. So, yeah. I kind of talked about melanin before. Melanin, significant factor in skin color produced by melanocytes. They accumulate in keratinocytes of the stratum basale and stratum spinosum. So as you have ultraviolet activation, the melanin gets produced by the melanocytes in the area that's exposed. The melanin then are just granules that's picked up by all the cells, all those keratinocytes that are in that area, darkening all those keratinocytes in that area. Now, when you're wearing a, all right, when you're wearing a watch, right, or when you're wearing a short sleeve shirt and you're working outside a long period of time, right? Well, the shirt is going to hinder that ultraviolet radiation, right? So then only the exposed part, like your arm, right, that's been exposed to the UV, will then receive the ultraviolet radiation. Melanin is going to be produced more in those areas. Those areas of skin will then darken, right? The areas that's not exposed will not receive the UV light, so will not have melanocytes activate in those areas, right? People of different colors have the same number of melanocytes regardless of skin color, right? So we have the same number of melanocytes, right? The dark skinned people produce greater quantities of melanin based on genetics, right? Melanin granules and keratinocytes more spread out. Melanin breaks down more slowly in darker skinned people. Melanized cells are seen throughout the epidermis, right? Now we're going to that just mentioned, people who are darker skin are less prone to sunburns and sun damage, right? And even some of the skin cancers they're less prone to, right? The problem is because they're less prone to it, most people don't think about cancers, right? In darker skin people. So the outcomes in people with skin cancers and your darker skin are much worse, right? The amount of melanin also varies with exposure to UV light. Again, this melanized cells allows us to have protection. Other things allows us to have this reddish hue, right? We call it erythema. So erythema, blushing, reddening of skin can be due to exercise, right? Or involuntary blushing, right? Keratin and jaundice, right? Jaundice is yellowing of the skin and sclera due to excessive bilirubin in the blood, right? Now, what we're going to see is that this jaundice, the best way you can see jaundism is by looking at the white of the eyes The white of the eyes is called the sclera, right? Everybody's sclera should be pretty white, right? When I start seeing yellowing of the sclera, immediately I'm thinking about jaundice, right? In America, what is the most common cause of jaundice and liver failure? Alcoholism. Right? Alcoholism one and two, right? Number one and number two causes, right? Then you can have other factors, right, that can cause it, but they're much, much less frequently seen. Now, the other thing is keratin, right? You hear these horror stories all the time where you have babies, right? And the mom and dad, when they're first born, no jaundice, nothing. They go home, no jaundice, nothing. And then you guys know that for the first 6 months of life, right? Babies should not be having any kind of solid foods. So after 6 months, mom and dad are really excited to give babies some kind of solid food, right? So if you're that excited to see your baby eat, what are the chances your baby's gonna like eating broccoli, all right? Or green beans? Pretty good, right? So most of the time, the babies are like all of us, they want something sweet. So sweet potatoes and carrots, right? So mom and dad start feeding sweet potatoes, right? And then like, oh my God, baby's eating, right? So, all right, the next morning, all right, what are the chances they're going to want to eat carrot? They're going to eat carrots then, right? They are. So you switch between sweet potatoes and carrots, sweet potato and carrots. And then after a couple of weeks of that, they start turning kind of this gold color, yellow color. And then mom and dad freak out, right? Why? It's because they think they have jaundice. The thing about this keratin, right, is that it doesn't affect the sclera. So if we look at the white of the eyes, it's still white, right? We just tell them that, yeah, maybe cut it away. Right? It's not going to cause permanent damage, right? If you want, you can keep giving it to them because it's not going to damage them in any way, right? But, if you don't want them to be, orange in color, right? You might want to decrease the amount of sweet potatoes, right? But, there's some people like that color, right? So, all right, cyanosis is blueness of the skin from deficiency of oxygen in circulating blood. Right, that can be due to just lack of oxygen in environment. It can be due to some kind of pulmonary disease in the person, or it can just be to the fact that you have a cold kid. All right, you ever have a friend that's always cold or a baby that's always cold? Right, right. I know YouTube, right? You guys are so thin, you guys. All right. So I never get cold, right? So, all right. I mean, but you do see like kids get really cold and then their cheeks get kind of, and their lips get really blue, right? Yeah, that's cyanosis, right? Now that if you remove them from that situation, obviously they're fine, right? Albinism, genetic lack of melanin, right? That results in white hair, pale skin, and pink eyes. By the way, do you guys know why genetic albinos have pink eyes? It's because they have actually no color in the iris. And because of that, we're actually seeing the blood vessels, right? Through the iris. That's a pink eyes. Kind of crazy. So people that have albinism, even on an actual like cloudy day, they have to wear sunglasses. All right. They have to be really careful about getting sunburns because you have no protection from UV light. All right. I'm not going to ask about hair and nails. None of this was highlighted. Even this and all this and functions, right? Fingernails, nothing I would ask, right? I would ask about glands, sweat glands, right? Sebaceous glands. And then we'll go right into, I'm just gonna stop it right here.